What you are about to see will include the portrayal of advanced life support skills. As a BLS provider, you may be on a team with advanced life support providers, but rest assured, those skills are not part of this training. However, no matter the skill, procedure, or equipment used in a resuscitation event, BLS must continue.
Successful teams not only have medical expertise and mastery of resuscitation skills, but they also practice good communication skills and adhere to the key elements of effective team dynamics. Team dynamics is an element of high-performance teams and can be broken down into 3 categories: roles and responsibilities, what to communicate, and how to communicate.
Clear roles and responsibilities should be immediately established by the team leader or the first rescuer on the scene. When all team members know their roles and responsibilities during a resuscitation attempt, the team functions smoothly.
The ideal situation is when multiple rescuers work as a team to perform all the needed roles in a resuscitation attempt. This figure identifies 6 possible team roles for a resuscitation. Note that some roles are typically performed by advanced providers. If enough rescuers are present, each rescuer takes a role. If the team has fewer than 6 rescuers, some team members may be assigned more than one role. Some roles have a higher priority than others.
The compressor assesses the victim and stays next to the victim's chest to perform chest compressions. When giving compressions, rescuers should switch compressors after every 5 cycles of CPR, about every 2 minutes, or sooner if tired.
The rescuer positioned by the victim's head maintains an open airway and delivers breaths while watching for chest rise and avoiding excessive ventilation.
The team member operating the AED, or the monitor defibrillator, can also serve as the CPR coach. The role of the CPR coach is to focus on team members' performance of high-quality CPR and to provide feedback as needed during the resuscitation attempt.
Every resuscitation team must have a defined leader who assigns roles and makes treatment decisions. Often, the team leader will be at the foot of the victim. However, the team leader may move around to observe and evaluate the skills of the team and to provide feedback when needed.
The timer recorder keeps a record of the events that occur, including frequency and duration of interruptions and chest compressions, time of shock delivery, and medication administration. When only 2 rescuers are present, they typically take the roles of compressor and airway, with one of them also covering monitor defibrillator and team leader. If 3 rescuers are present, they take positions around the victim in the 3 critical roles: compressor, airway, and monitor defibrillator.
Every member of the team should know his or her limitations. Team members should ask for assistance and advice early, not when the situation deteriorates.
I'm getting pretty tired during these compressions. I'm gonna need some help after this.
Sometimes a team member or the team leader may need to correct actions that are incorrect or inappropriate. It's important to be tactful, especially if you need to correct a colleague before they make a mistake.
And now you're too fast. Target heart rate is 110.
The next category is what to communicate. Knowledge sharing and summarizing information are critical components of effective team performance. Team leaders should review what's happened and ask for ideas and observations from team members.
Can you give me a recap, Nick?
Yes, we've been doing CPR for about 4.5 minutes. We've got 1 shock, 2 no shocks, and you've given 1 dose of Epi-IV.
Okay, so anybody have any ideas on what else we can try with this patient?
The last category is how to communicate. Closed-loop communication is the process of verifying that the message sent was received as intended. It also verifies that any assigned tasks have been completed.
So, Scott, why don't you give 1 milligram of epinephrine?
1 milligram of epinephrine IV.
In addition to using closed-loop communication, teams should use clear messaging to help prevent misunderstandings. Teams that work together frequently can create terms or phrases that have specific meaning for them to ensure clarity among members.
145.
Okay, let's go ahead and charge up.
Charging.
Do we have good pulses with CPR?
Good femoral pulses with CPR still.
Finally, teams need to communicate with respect. Speak to each other in a professional manner, regardless of scope of practice or expertise. Resuscitation events are stressful and emotions can run high. Understand that this is the nature of CPR and remain focused on the life you're trying to save.